Welcome to this video, which will explain how to use the PPM Multi-Patient View. The information in this video applies to all adult medical wards. Please note that clinical information entered into the PPM Multi-Patient View does not alter any existing digital processes, use of clinical systems, or documentation in the medical and nursing notes. To get started, log into PPM Plus. Choose Ward from the search bar drop-down menu and enter the ward number. Select Search. The multi-patient view for your ward appears. Information about each patient and their current stay is displayed in the columns to the left, including their location, the ward and bed number, their name, age, the time since arrival to the ward, consultant, speciality, and length of stay. Hovering your mouse over the information in these columns presents a tooltip that may contain further information. Alternatively, click into a cell to see full details and, where available, options for updating the information. To the right of the multi-patient view, information relating to the patient's observations is displayed, including the current and previous news, the time when obs are next due, and observation frequency. To view all of the columns required to support your ward, you may need to edit the multi-patient view. Click Select Columns. To add columns to the view, click on the plus button. To remove columns that aren't required, use the bin icon. Select Save. Admission review is recorded in the AR column. It is the responsibility of the nurse in charge or ward clerk to add consultant and junior doctor clerking required to PPM Plus. As soon as you select this, a timer commences for clerking and consultant review. Click on the blank AR box, Admission Review, in line with the patient's name. Select Required for consultant and junior doctor review only. Choose Submit. In the AR column, the time of wait for clerking or consultant review is displayed. To record the clerking review, click on the red JD text. Select Completed in the Junior Doctor section. Select Submit. The AR column on the whiteboard view will display JD in green text, indicating that clerking has been completed. The same process is followed for consultant review. Handover comments should be restricted to any jobs or tasks that need chasing, for example needs urine dip or chest x-ray, and any other actions that may need follow-up by nursing and medical staff. Click into the handover comment box. If there is an existing entry in the handover comments field, type your entry before the previous entry. If the entry is from a ward round, start the entry with WR, your name and the date, then type your entry below. Choose Submit. The Other Jobs column should be used for COVID details only. This free text column should be updated by both nursing coordinator and medical staff. This will change after the COVID pandemic, but it is crucial for managing inpatient bed capacity. Click into the Other Jobs field. Only enter in the comments awaiting COVID swab sent and date, COVID swab negative, or COVID swab positive. Click Save. The clinical summary column should be updated following every ward round or medical patient contact. Clinicians should insert comments relating to working diagnosis, treatment plan, escalation ceiling of care, DNA CPR, or any other key information. Click into the clinical summary column. Enter your comments above the previous entry, ensuring that it is prefixed with WR if from a ward round, your name and the date. Select Submit. Ceiling of care and escalation is essential for every patient to help coordinate and manage HDU and ICU services and demand. An appropriate discharge transfer plan should be completed following every ward round and patient review. The expected date of discharge, EDD, medically optimised for discharge, MOFD, and whether the patient needs to be on an acute assessment ward should be completed in full. Click into the EDD column. The estimated date of discharge must be entered for every patient by the medical staff. The EDD should be checked and adjusted by the nursing staff at handover. Use the calendar to enter an appropriate date. Update the medically optimised for discharge field and answer any other questions. Choose Submit. Complete the planning and needed for discharge transfer columns for any patients who are ready for discharge. Click into the Needed for Discharge Transfer column. Update the responses to the questions at the top of the dialog box and scroll down to the Planning section. If the patient is being discharged home today, select Home, going home without any further support. Then select Discharge as the destination. If there is no option to record the relevant discharge location, select Other and enter the location in the Additional Information free text field. If the patient is being transferred to another ward, select Internal Transfer, choose the correct hospital site and the ward. If the patient is being transferred outside of Mid-Yorks, select External Transfer and enter the hospital. Click Submit. The CR Clinical Review column will be reset each day to show a consultant review is required. Record that the review has been completed by clicking on to CON in the CR column, then select Completed. Use the Medical Jobs column to update any element of the medical or nursing jobs that arise from the medical reviews of the patient. It is essential to remember that use of these columns should not alter any existing digital processes, interaction with other clinical systems as per trust protocol, and this process does not reduce or replace the need for documentation in the medical or nursing notes. For PPM Plus support or access queries, please use the contact details on screen.